In continuing my discussion about recovery after surgery, next operation I think we'll talk a little bit about is breast augmentation. Breast augmentation is always done under general anesthesia, but in my experience over time, I've learned that long-acting local anesthetics really change the nature of the operation and the recovery dramatically. What is interesting about us as far as surgery and emerging from anesthesia is if you are in pain when you awake from anesthesia, pain tends to get worse. And when pain gets worse, your requirements for narcotics goes up. It's the narcotic pain medications that are the ones that are problematic. They cause nausea, they cause constipation. People don't like the way they are thinking and feeling while on narcotic medications. So, interestingly enough, when I was in the military, we had the advantage that people could stay overnight if they wanted to at no additional fees in the military hospital. And when I was trained to do breast augmentation, I didn't use local anesthesia at all during breast augmentation. And I found that 90% of my patients spent the night. When I started to experiment with different ways of doing local anesthesia, what I found was more and more of my patients went home. And when I finally perfected the technique that I used currently, 90% of my patients went home. Not only do they go home, they require less pain medication and they have increased range of motion. So that, by day 5, it's typical for my patients to be off all medications, driving, and getting back to work after a traditional or standard breast augmentation.